Thanks, Jerome. Good morning. So we are seeing the virus active in a number of places, as has been mentioned: Ballon, Bacchus Marsh, Barwon Heads, Phillip Island, and in suburbs across Melbourne and in some of our biggest sporting stadia. We have multiple sites of transmission and more than 160 exposure sites across Victoria. That includes restaurants and pubs, sporting stadia, MCG and Amy Park, the Cerberus Naval Base, and then multiple schools, so Bacchus Marsh Grammar, Barwon Heads Primary, St Patrick's School and Trinity Grammar. The infection patterns here and overseas tell us that younger adults, teenagers and people in their 20s and 30s absolutely become infected, especially with this Delta variant. There are young adults in hospital right now around the world, including in New South Wales with COVID-19, some with very severe illness. COVID-19 can infect anyone, anywhere. Yes, there are higher risk settings. Yes, there are individuals who are at greater risk of more severe disease, but anyone, anywhere can become infected, any household, any workplace, any part of Victoria. The Delta variant is different to previous strains we've seen before. It's becoming the global predominant strain, and we're really seeing a third wave globally with the Delta variant. It is more infectious. It's infectious earlier in the incubation period, and the incubation period might even be shorter than the average of 5 to 6 days that we've seen with other variants. And so that becomes a big challenge from a contact tracing point of view and from the transmissibility of that virus. So we need to protect all age groups, and effectively that's by getting vaccinated as soon as you're eligible, understanding that not everyone's eligible right now, but as soon as you're eligible to get vaccinated. I've booked in for my second AstraZeneca jab for later this week. So I do encourage everyone who's had their first vaccine, whether you've had Pfizer or AstraZeneca, to finish the job, get that fullest protection you can by getting your second dose. We do continue to see a great response to vaccinations. We're all clear that that's the way out of this pandemic. There were 19,237 Victorians who came forward yesterday to get vaccinated. That's a fantastic number. There are still spots available for Pfizer vaccinations, so over the next 3 weeks there are 35,000 spots still available for dose 1 of Pfizer, and there are 69,000 spots still available for dose 2 jabs. In addition to this, we've prioritised 10,000 Pfizer appointments for our most at-risk workers and residents, regardless of age, and there's still plenty of capacity for AstraZeneca as well. We have prioritised all healthcare workers, all hotel quarantine workers, including the medical and support staff, as well as the ADF and Victoria Police personnel. All international border workers, including our airport and marine port staff, as well as those working in the red zones, such as authorised officers, Australian Border Force, and our COVID testing staff. All household contacts, so those aged 16 years and over, of our hotel quarantine and international border workers. And then, of course, residential, aged and disability care workers and residents. So all of those are prioritised for vaccine. Those appointments for people in these categories can now be booked through the coronavirus hotline on 1800 675 398 or via the online booking portal. Our frontline workers and those living in vulnerable settings are at the greatest risk of transmission. Finally, please, as we've said, check that list of exposure sites. Check it every day. It's updated multiple times per day. Over 160 sites now, but there'll be new ones today, there'll be new ones tomorrow. It gives our public health team that vital information to chase the virus down. But we want to get ahead of it. It's not just about keeping up. Drive this completely into the ground, and our public health teams are working day and night to keep us safe. My final advice, as we stand today with an escalating situation, is really follow those lockdown restrictions. Only going out for those 5 essential reasons, and only really as essential. Please check the exposure sites. Please get tested if you have any symptoms whatsoever. Get vaccinated if you're eligible. and you are free of symptoms, don't go to a testing site if you've got any symptoms at all, or to a vaccine site, sorry. And if you have to isolate, you must isolate. That means not going out for anything other than emergency reasons, in which case you should be calling an emergency number and identifying yourself as being in quarantine. And check in with those QR codes everywhere and every time. Thank you.
Professor, can we just very quickly?
I can carry on?
Yep. Can you just clarify the current advice to household contacts of anyone who's been to a Tier 1 site?
So household contacts who've been to a Tier 1 site need to quarantine for a full 14-day period. That's regardless of the testing results that they get over that 14 days. They'll be prompted to get a test early on, because if they're identified as a case, they're managed differently. But even with a negative test, if you've been to a Tier 1 site, you have a full 14-day period of quarantine that you must complete.
One of your new Tier 1 sites is a gym in Richmond. 2 separate days appears to be 2 separate classes. If Delta is that infectious, how worried are you about those 2 exposure days?
Look, it always depends on the individual who's been there. Are they right at the beginning of their infectious period? Are they maybe one of those fortunate individuals who's not as infectious? But the Delta variant has people who are more infectious more often. So, of course, it's a risk. But any of those exposure sites are a risk. We flagged many times before that indoor areas with exertion, especially with no mask wearing, if that's the case, are an even greater risk. So everyone needs to check those exposure sites and to quarantine appropriately.
Just on Richmond, we understand there is an apartment block that's been visited by DHHS officers in hazmat suits. Is that inner city Richmond apartment block in lockdown?
So it is a site with a case and Jerome might be able to give some operational details on the response, but it's effectively the response that we've had for other housing settings where there are multiple individuals nearby, but they're being supported to be tested and they'll need to quarantine for that period of time as well.